First off, apologies for the background. It's very, I don't know, very modern art for me, which is not typically my MO. A couple news stories for today and then one personal indulgence, if you will. So this is actually just a general PSA for our audience members who maybe aren't dentists or aren't even in the dental profession or whatever, but this is an ongoing trend that every week I read about yet another unlicensed dentist either being arrested or having done some untoward thing towards someone else. So I'm done with it. I'm not going to talk about any more stories about unlicensed dentists. What I'm going to talk about is to the general population of the United States of America and every state. Please, I know that you have lived in a comfortable and luxurious life up until today. You don't go to your state licensing board and look up your dentist to see if they're actually licensed in the state, but we absolutely must start requiring that. Now, if they're listed with your insurance company, I guarantee you they are licensed, because when we go in network with an insurance company, you have to go through a pretty arduous process of presenting documents. For our non-in-network dentists, you are going to have to go to the state board to actually look up their license. That's it. I'm done. You've been warned. If you go to someone in their home, you go to a back alley, you go to a garage, you go to a hotel, it's on you. If you go to what appears to be a very nice office and they're still unlicensed, you have to look that stuff up. That's what the veneer techs were doing in multiple states, where you would swear that they were a dentist and yet they were not. There are scams and fools amongst us all. So now, as a precautionary tale, we must go to the internet. We must go to our state boards and look up licensure. 2 more dentists were arrested yet this week in Illinois for practicing without a license, without any credential whatsoever related to dentistry, for administering medications, taking teeth out, and causing an ill infection that ended up landing a patient in the hospital. So look, shit happens to even really good doctors, but at least go to really good doctors. And another story, which has been very interesting to me because I actually caught myself quite unaware. So we've been talking about the Hygiene and Dentist Compact. That's been going on for quite some time. The concept or proposal is to get this interstate licensure relaxation, where it was originally meant for military families. If you were married to someone in the military and you kept getting moved around, then it would be easy for you to go through a licensure pathway so that you wouldn't have to keep going through re-credentialing and retaking boards and all that stuff. That was a very noble cause and I think had a lot of good merit. What it has opened up, though, was an opportunity for portability. Fine. There's been a ton of push for national licensure for a really long time. But now I think there's another bill that is moving in a different direction. So now we have 2 competing compacts happening simultaneously, which I actually didn't know about. There is an Interstate Dental and Dental Hygiene Licensure Compact created by the American Association of Dental Boards. It's one of the 2 different compacts. Now, Mississippi and Louisiana are both a member of this compact. Missouri, Pennsylvania, and Massachusetts have also brought legislation forward to join the compact as well. So great. Now we have multiple compacts managing multiple licensures all at the same time. Like, that's a bit of a challenge as well, right? Not going to move us towards licensure, and actually now muddies the water quite a bit. And with that, that's the news.